Care Central is brought to you by Baptist Health Lexington.
Good evening, I'm Dr. Jeff Fox, host of Care Central, and tonight we're going to talk cardiology. My first guest this evening is Dr. Paula Hollingsworth, who is a general interventional cardiologist. Welcome, Paula.
Thank you.
Now, you brought your Healthy Heart Top 10
Yes.
that we're going to talk about today. And number one, it says know your family history. What do you mean?
Family history is important because even though you can't do anything about your family history, it can alert you to what you need to pay attention to as you're getting older. So if your family has heart disease in it, if your parents had heart attacks when they were relatively young, if they have high cholesterol, if they had high blood pressure, it's very important for you to know those things so that you can watch for those things in yourself.
You can change some things, but you're stuck with your mom and dad.
You're stuck with your mom and dad.
Number 9, if you think you have sleep apnea, request a referral for a sleep study. So what is sleep apnea and what's it mean in heart disease?
There's a lot of people out there, or at least in my population, that have sleep apnea. And they, even though you would think that most of them tend to be the overweight individuals with kind of a thicker neck and a stocky build, that's not always true. And signs, for instance, I've got a woman who's 5'4" and weighs 120 pounds and has horrible sleep apnea. She's actually the one who told me she thought she had sleep apnea. But signs would be fatigability early in the day. You tend to fall asleep after dinner, fall asleep at stoplights. You're as tired when you get up in the morning as you are when you go to bed at night. And you tend to snore, and a lot of times people around you will hear sonorous sounds while you're sleeping, and they may notice that you might gasp in the middle of the night. So if any of those things are present, it's important to get a sleep study.
Even stop breathing in the middle of the night, and people with sleep apnea have a higher incidence of blood pressure, heart disease.
They do. They have a higher incidence of hypertension and a fourfold increased risk of atrial fibrillation.
And that's an arrhythmia,
abnormal heart rhythm.
Heartbeat.
The other thing is long term, it can lead to elevated right heart pressures and problems that go along with that. So if you have it, it should be treated.
Number 8, make sure your hypertension is treated.
Hypertension is a silent killer. They've been saying that for years, and it's so true. It's easy to not acknowledge that you've got hypertension. It's easy because you don't know. Sometimes you can't tell. Some people have headaches, some people don't. But long term, it does damage to the heart in that it makes the heart muscle very thick. The heart has to work harder. It causes all of the arteries in your body to become thicker than usual. It can cause end-stage disease and problems with your kidneys, with your eyes, with your brain. It's something that definitely needs to be treated.
Now, and you can get your blood pressure checked a lot of ways, easy. I mean, even the pharmacy, the blood pressure machine is a good screening way.
Absolutely, and they've got pretty decent automated blood pressure cuffs at places like Walmart and Kmart, and they're not that expensive. You know, you can pick up a decent one for $40 or $50 and check it at home. But you're right, I mean, a fire station can check it, your doctor's office can check it. You don't have to see the doctor. The nurse at your doctor's office can check it.
A simple way that might prevent a catastrophic event. Number 7, pay attention to your symptoms.
Yes, you have to pay attention to your symptoms because even if you know the symptoms of heart disease and you're aware of them, if you're one of these people in denial and you think that it can't be me, it's not going to help you any. You know, long term, it's not going to, you're going to be there one night and thinking that maybe this indigestion could be heart disease, but not me. Don't wait. If you think that it could be your heart, be seen in the emergency room immediately.
Women's symptoms may be different than men's.
They may be. A lot of times, and men's symptoms can be different as well, but women tend to have atypical symptoms more often. They tend to have things like fatigue, just shortness of breath, maybe some indigestion. You can have right shoulder pain, left shoulder pain, and my what I usually tell people as far as a guide is anything that is exertional, reproducible, and above the waist can be related to your heart, so get it checked out.
Eat a healthy diet, know your BMI, body mass index.
Body mass index has really come into play the last few years with the incidence of obesity. There are 68% of the people in the United States that are either obese or overweight, and as far as obesity goes, 35% of the American population are obese. You should know your BMI. It's a huge risk for heart disease, and it goes along with a number of other bad behaviors if you look at the people that are obese.
You've got number 5 is exercise, but that could be exercise, because it also affects your cholesterol, which is Number 4.
Right. And exercise and diet will definitely affect your cholesterol. The more you can exercise, the better. I think it's something that we don't do very often as Americans, and we need to do better.
Number 3, stop smoking.
If there's one thing that you can do for yourself, it would be to quit smoking. It's not good for anybody around you. It's not good for you. It increases your risk up to 4-fold for having heart problems. It's not good. And it's the only thing that physicians can't control. It's the only thing I cannot do for my patients. I can improve their blood pressure. I can make their cholesterol look prettier. I can help their blood sugars. I cannot make them quit smoking. It has to come from within.
But it's hard to do.
It is hard to do, but it is doable, and the first step is just making up your mind that you have to do it.
All right, number 2, know the symptoms. What's something you got to, man, this is the real thing.
If you have discomfort of any kind that will not go away and it gives you a feeling of impending doom, it is a sign that you should go on and have it checked out at the nearest hospital. And it's better to have somebody call an ambulance for you than to drive yourself or have your family drive you, because if you collapse in the car, your family's stuck. They either have to drive faster or stop and do CPR. If you've got symptoms that come on and they will not go away and they're uncomfortable, don't lay there all night. Go get it checked out. We only have about 4 hours to save heart muscle.
Well, there you go. And number 1, if you're concerned that you have a heart problem, discuss it with your primary care physician, and like you say, if it's an urgent matter, get to the emergency room and get
Absolutely.
there fast.
Yes.
All right. Thanks for coming in. Thanks for the top 10 healthy heart tips. We'll be right back.